And ladies and gentlemen, please stand by. Good day and welcome to the All Things Financial regarding the Cancer Journey conference call. Today's conference is being recorded. And now at this time, I would like to turn the conference over to Jennifer Gillette. Please go ahead.
Thank you, Jake, and thank you everyone for being here with us today. Yes, I'm Jennifer Gillette, the staff social worker at the National Bone Marrow Transplant Link, and I'd like to welcome you all to this call. This month's program will focus on all things financial on the cancer journey. A special thank you to our sponsors for today's program, the Leukemia and Lymphoma Society, Insight Corporation, Pharmacyclics and Janssen, and the Omeros Corporation. We also thank our esteemed LINK partners. Just so everyone knows how the program is going to go today, we'll have a brief introduction about the National Bone Marrow Transplant Link for anyone who might be new to the call. Then we will also hear from Nicole Jolicoeur from Triage Cancer. Then we have a caregiver speaker today, Tina Odum, and then we'll open up the floor for questions. For those of you who may not be familiar with the link, our mission is dedicated to helping individuals and their families from diagnosis through survivorship. We provide resources, support, and education. Some of the resources we provide to help families navigate their transplant journey are our webinars, podcasts, blogs, lunch and learn calls, such as the one you're on today, which we have them on chronic graft versus host disease, disease-specific information, caregiving, coping, treatment options, survivorship, and more. We also have a content-packed Facebook page with daily inspiration and relevant tips for our survivorship. We have a peer support mentor program for patients, as well as caregivers and donors who are interested in talking to others who have walked the road before them. We have our second birthdays recognition program. We have books, referrals, and emotional support from a licensed social worker. So if you need more support, please reach out to us. Before we begin today's program, I'd like to review just a couple housekeeping items to maximize the experience of all on the call. First, please be mindful in being concise with questions so that we may answer as many as possible. In addition, we also ask that you remember the information provided in this program is meant to stimulate conversation with your own healthcare team and is not meant to replace your individualized medical plan. So now on to the educational part of our program. We are very lucky to have Nicole Jolicoeur with us today, and again, she joins us from Triage Cancer. Nicole was an Excelsior Fellow at the New York State Office of Mental Health and Counsel's Office. After leaving OMH, Nicole worked as a staff attorney at a nonprofit representing incarcerated individuals, civil and human rights on a variety of matters, including access to medical and mental health care. Nicole earned a Juris Doctor from New York Law School and a Bachelor of Arts in Psychology and Criminology from Hofstra University. She is a member of the New York Bar, and Triage Cancer is the organization nbmtLINK always goes to when we have legal questions. So we are so thankful to have you here today, Nicole.
Oh, thank you very much. Hello, everyone. Thank you for having me this afternoon. I'm really looking forward to discussing managing finances after a cancer diagnosis. So those of you who haven't heard of Triage Cancer, I just want to give you a brief introduction so that you have some background for what I'm going to be discussing moving forward. So we're a national nonprofit organization, and we provide free education on the legal and practical issues that can impact an individual diagnosed with cancer as well as their caregivers. And today I'm going to be referencing a lot of our materials as written forms of the information we're discussing. So just so that you know, our website, triagecancer.org, has a lot of these materials that are available for download for free, including quick guides that are brief introductions to topics and animated videos on a lot of these topics if people prefer to listen to information instead of read information. And then we also have webinars and other events that you can find more information on our website. At the end of this call, I'm going to be emailing Jennifer a direct link to each resource that we talk about so that you can all have access to that as well. So our goal today in discussing managing finances after a cancer diagnosis is to help people combat financial toxicity. And this is a term that was coined by Duke researchers in 2013 because they were researching the financial impact of a cancer diagnosis. And they found that it has actually a similar impact to the actual physical toxicity of treatment. And not only in an acute way, but also a long-term impact. And it's not just someone's bank account, it's also their mental well-being as well as stress. And so there are a few contributing factors to financial toxicity, including employment changes and life changes that can come with a diagnosis. But a primary culprit is health insurance. And so that's why we're going to be focusing on a few parts of leveraging health insurance today as a way to manage finances during a cancer diagnosis. And so it's not just having adequate health insurance, but also being able to use the health insurance that you have to your advantage. And unfortunately, the reality is that it can get a little bit complicated, and often people are left feeling overwhelmed, particularly by the amount of correspondence they can receive from just one care appointment. And so oftentimes we hear individuals saying, I'm just letting the bills pile up, I'm just letting my mail pile up. And while that is a coping strategy, we actually hope that providing some information around the process can help people feel that it's a more manageable process, get organized, and then make the most out of their health insurance. So one of the first things that individuals can actually do to make the most out of their health insurance occurs before even receiving care. And it's actually, we really urge people to have more communication with their healthcare team about the expected costs of a procedure, of treatment, of anything that's going to happen. And while that might seem surprising or particularly uncomfortable, if you think about it, healthcare is one of the few areas where we go in and receive a service that we don't actually know how much it's going to cost us. And in having a conversation beforehand, it can be very helpful for a few reasons. So first, if an individual has an idea of the expected costs, they can start to plan for those costs. But it also opens a dialogue where they may be able to actually find out that the hospital or provider has something like an ability to pay program or other types of financial assistance, or that, for example, if someone pays in a lump sum, part of the fee is removed or reduced. And so that's just a helpful starting place. And it can also help people start to consider other potential options for treatment or even timing of treatment. So what I mean by this is oftentimes we get calls from people where they're surprised that their insurance actually has a network of providers and that different providers can charge different rates. So while we're never suggesting that you go to one provider just because it's cheaper, there may be an option where you can still receive the same care, but perhaps a hospital close to you has a lower rate, for example, for an X-ray, where an individual can get an X-ray there, save some money, and have the results sent back to their provider. But again, that's always a conversation you want to have with your treatment team. And discussing these costs beforehand can help people start to open up these types of options. But even if an individual is already comfortable having these conversations before care, there can be a lot of communication post a treatment or an appointment or an X-ray. And so we found breaking down the different types of communication an individual can receive can make it a lot less overwhelming, make it more likely that they're going to open those communications and keep them organized. So first, from an insurance company, there's typically 3 types of paperwork that an individual is going to receive. The first is an acknowledgement that the insurance company's received a claim. The second, that they're processing a claim. And the third is called an explanation of benefits. And this is actually the most important document that an individual is going to receive from their health insurance. And that is because it is going to explain what the health insurance is going to cover for that care. Now, an explanation of benefits can differ how it looks based on the health insurance company that an individual has. However, there are some main components of an explanation of benefits that should be true across each health insurance company. So the first is typically it's easily identifiable because either somewhere in capital letters or bold letters it says this is not a bill. And then there's typically a few main parts of information. So the date of service for this particular service, say an X-ray, and then an identification of the type of service received. Sometimes there are no words. Instead, there's something called a Cpt code that can really throw people. They're usually numbers that are able to be Googled, but if someone's struggling or just wants extra reassurance, they can always ask their provider or their health insurance company what that code means. And then they'll see a few other numbers. So first, they'll see the amount charged by the provider. They'll see the amount paid by the health insurance company, and then the amount that they owe. So this can help someone see what their total cost for that service is. Now, a great explanation of benefits will also include a few more details, and that will be how much an individual has paid towards their deductible, so the amount that they have paid before their health insurance will kick in, and then how much they've paid towards their out-of-pocket maximum. And we really urge people to understand their out-of-pocket maximum because it can help you leverage your health insurance in that if there are other types of care that you've been putting off, potentially because of the cost, once you reach that out-of-pocket maximum, if you're going to in-network providers, your health insurance will typically cover it at 100%. So when we're talking about managing costs after a cancer diagnosis, that out-of-pocket maximum is a very useful tool. Now, what can be particularly frustrating to people is that the three pieces of paperwork that I just discussed don't necessarily come in that order. And then there's a fourth piece of paperwork, and that's the bill directly from the provider. And oftentimes, people get this bill well before their insurance company even acknowledges the claim. So it can be confusing and frustrating. And so we have some particular tips that can be helpful when managing costs. So the first thing is when an individual gets a bill, sometimes they just immediately pay it. And we actually urge you to pause, take a step back, and see, one, if you have the explanation of benefits, because your bill may not be accurate in that your health insurance may have covered more than the provider has on record, and so your bill could be more than you actually owe. And when people pay that before getting the explanation of benefits, it can take a while to get the money back from the provider. Now, we don't suggest ignoring the bill. You can call your provider and let them know you're waiting on the explanation of benefits, ask if they can change the date of the bill, or at least make a note in your chart. Now, even after you receive the bill and you have the explanation of benefits, we actually urge people to actually look at the bill and review it for accuracy. And what I mean by this is that medical billing is a human process. And so with human process, inevitably can become errors. And so we've seen a lot of different things over the years, but there are a few common things that we suggest people look for. So as I mentioned with the explanation of benefits, there's Cpt codes, which are current procedural terminology codes that can be Googleable. We suggest that people actually check the code to make sure it's for the service they received. Because it's a number code, if someone misses a number or adds in a number or accidentally changes the number, you could be getting billed for a surgery when you had blood work, and obviously that changes the cost. And then potentially, you could be billed for a service that you didn't actually receive. For example, sometimes a provider will suggest blood work or another test and then change their mind. And if this is on your bill, obviously if you haven't received the service, you don't want to be charged for it. And then the last common thing that we see is that a number is incorrect. So instead of putting down one surgery, someone hit the one button twice, so it's 11 surgeries that you're being charged for. So while I understand this is a lot of steps for an individual to take in a particularly difficult time period, there are a few ways to ask for assistance. So sometimes people find that they can enlist the help of their friends and family to open mail, organize it, to make sure you have all the correspondence for one procedure in one place. And then other times people really do want the help of a professional organization. So there are professional bill reviewers and medical claims, one of which is the Alliance of Claim Assistance Professionals, or ACAP. Now, they are an alliance, so they will put you in touch with different claims reviewers, so the amount that's charged can be different based on the claims reviewer you get. And then there's also an organization called Citizen that can help people gather their medical records, and I'll provide more information on that sheet that I discussed about them as well. And so when you're reviewing medical bills, there may inevitably become a time where a health insurance company denies coverage for a claim. And it's really beneficial for people to understand that they don't have to take no for an answer. And generally, as consumers, we have the right to appeal a denial of coverage, typically at 2 levels. So the first level is called an internal appeal, and that's essentially where an individual goes back to their health insurance company and asks them to reconsider. The second is an external appeals process, and this process and who it is run by can differ by state, and we actually have more information on our website, on our chart of state laws, for the contact information of each state's health insurance agency. But what an external appeals process typically is an individual now goes to an outside organization and asks them to review the claim to see if it was denied properly or not. And this decision is binding on the health insurance company. Now, when we're talking about health insurance appeals, we try to break it down into 3 separate steps for individuals. And the first step is identifying the type of health insurance plan they have. And what I mean by this is an individual may know that they have an employer-sponsored plan, but there are actually 2 types. One is called funded and another is called self-funded. And we have additional information on our website if people are confused by the 2. But there are other types of health insurance as well. Someone may have Medicare or Medicaid or even an individual plan. And so the reason it's important to identify a plan type is that the appeals process rules can vary based on your type of plan. So after an individual identifies the type of plan they have, they then need to understand the reason for the denial. And there are several common reasons for denial, particularly when an individual is diagnosed with cancer. But one of the ones we see frequently is that a service is considered experimental or investigational for that person's condition. And what I mean by this is sometimes there's an off-label use for a drug. For example, say an individual is diagnosed with prostate cancer, but there's been a lot of research that a drug typically used for lung cancer is beneficial for his condition. And his provider decides to prescribe him that drug. His health insurance company may deny that as experimental or investigational because it's being prescribed for prostate cancer instead of lung cancer. In that instance, he would be able to do an appeal, and he wants to work closely with his healthcare team. And that is because the third step of the appeals process is gathering evidence of medical necessity. And medical necessity is the standard that an individual needs to prove to show that the health insurance company has to cover the treatment. And so most of the time, patients aren't going to be able to prove this without the help of their healthcare team. And so it's really critical that an individual can work with their healthcare team or nurse navigator or social worker to help them gather the evidence. And the evidence can be very wide-ranging. It could be a letter of support from the healthcare provider. It could be results in tests, that are related to their care, or it could even be current medical literature or studies. And so it's important to reach out to find out what can be supportive of your health insurance appeal. Now, even when individuals understand the general process of the appeals process, there are a few hurdles that we commonly hear from. And the first is typically surprising to people, and that can be the difficulty of accessing medical records. And so if someone's receiving treatment across hospital systems, it can be challenging and taxing to gather all of the medical information. But most of the time, they're going to need a decent amount of their medical records for an appeal. So Triage Cancer has a guide on how to access your own medical records. But if an individual feels like they're particularly in need of help, there is an organization called Citizen, and they help individuals diagnosed with certain types of cancer to gather their electronic medical records, and Citizen will also provide a summary of that individual's medical records for them to review. Now, another hurdle is that there are a lot of steps in this process, so it can be difficult to stay organized because you need to keep track of dates, times, and any contact you've had with either your providers or your health insurance company, as well as the names of the people you've talked to, any documents you've sent or received, and then, of course, any timelines for the appeals process. And so this can be where family and friends, again, can be helpful. But we don't suggest just writing things on sticky notes. It can be helpful to have a binder or a notebook or a worksheet, whatever works best for you, so that everything is in one area and not easily lost. If you're looking for a place to start, Triage Cancer does have a free downloadable appeals tracking form that you can fill in on your computer and save to your own desktop. Now, another issue that we hear often is that people are confused by their health insurance's internal appeals process, particularly when a health insurance company takes part in what's called peer review. So a health insurance company may, in fact, hire another healthcare provider to talk to the individual's prescribing provider. And they're going to talk to each other and discuss the treatment. Now, one of the challenges of this can be an individual diagnosed with cancer is usually getting rather specified medical treatment. But the health insurance company does not have to have the individual who's a peer reviewer be in the same area. It could be a gynecologist, for example. And so sometimes that can make things difficult. And it can be helpful for your provider or an individual's provider to ask to speak to another oncologist instead, for example. But then there's often a challenge that individuals misunderstand the peer review process and actually think it's an external appeal, and they don't avail themselves to that right to appeal. So it is actually not an external appeal, and it is, in fact, part of the internal appeals process, and I think that's just important for people to understand. Now, I understand I'm adding something to an already busy schedule for a lot of people, but another hurdle that we see is people don't understand that they have this right, and the reason that Triage Cancer emphasizes it as such a critical tool is because there's actually data that shows between 50 and 60% of health insurance appeals that are denied are found in favor of the individual who appealed. So that's a critical tool when we're talking about battling financial difficulty during a health care situation. And so, in fact, only about 0.2% of claims denied are actually appealed. So we feel that this is a very underutilized tool. And because of that, we have a lot of resources specifically related to health insurance appeals. They can all be found on triagecancer.org/health-insurance, but I want to highlight a few. So if someone's looking for a brief introduction, we have our quick guide to appeals for employer-sponsored and individual health insurance. but we also have a quick guide to accessing medical records. And then if someone wants more information geared towards their type of plan, as I discussed at the beginning, we have a more interactive website called cancerfinances.org, where someone can select the health insurance appeals module, answer some questions, and get more information targeted to their situation. And for individuals that feel that they prefer to listen to learn, we have a brief animated video as well as a recorded webinar online. Again, I will provide the direct links to each one of these, but I thought it could be helpful for an understanding of what we have covered. And so there's a reason that we're focusing on medical bills and financial planning, and that's because people are often surprised to find that if they do not pay their medical bills, they may reach a point where they're unable to receive care from a particular facility or provider. And that's because in this country, providers are only required by law to provide emergency care, and it's actually a super limited definition of what emergency care is. So we don't want people to get to the point where they're not able to get care or other actions have been taken, such as the garnishment of wages to pay some of the debts or even repossession or bankruptcy. Now, we have additional information on our website about these processes as well. So there's some new news in that Equifax, Experian, and TransUnion, the three major credit reporting bureaus, are changing how they report on medical debt that's entered collections. So effective July 1st, 2022, so next month, if an individual has paid their medical debt that entered collections, it's going to start being removed from their credit report. And this is important because it actually typically stays on people's credit report for several years, but now it will be removed. And then the time period that it used to be for people to have their medical debt in collections appear on a credit report was 6 months. That's now going to be extended to a year. So this is really important information for people who are particularly concerned about their credit score or credit report. And then in the first half of 2023, credit reports are not going to include medical debt in collections that are under $500. And so this was very much a brief overview of several topics. So in addition to pointing you to the resources I've already discussed, I also briefly want to mention another free resource of ours. We have our Legal and Financial Navigation Program. And what that is free one-on-one help for individuals diagnosed with cancer, their caregivers, and healthcare professionals. And we ask that people go to triagecancer.org/gethelp. They'll fill out an online intake form with more information about what their question or concern is. And if they provide their email, they'll be sent an automatic scheduling email to set up a call with us. During that call, we're going to ask for more information, and then our goal is to explain what their options may be, provide accurate information on any potentially applicable laws or rules, and empower them to take next steps. So thank you so much for having me today. I hope this has been helpful and that you continue a relationship with Triage Cancer.
Thank you so much, Nicole. It's so great to have someone who is so aware of the laws and ways to help people make good decisions here. We also want to bring you one more speaker today before we get to our questions. Our next speaker is Tina Odum. She's a caregiver to her husband who has been fighting cancer for 12 years. He's been through 2 stem cell transplants and CAR T-cell therapy. She will share what she has learned along the way, practical experiences, and will surely help you navigate the financial journey. Thanks for being here, Tina.
Thank you. I appreciate the opportunity to speak to everyone. Yes, it's interesting to listen to Nicole because so much of really what I have to say kind of mimics that, maybe a little bit deeper and more specific for things that I did. But for me, I truly believe in the binder, keeping everything straight. We have had a binder that was for the medical side of it. What are test results? What are going on? What are treatment options? But I keep a separate binder for all of the billing, explanation of benefits, and we have a primary and then a secondary insurance. So in the front of my binder, I always keep all of the phone numbers, policy information. I also keep them on my phone because I often find that I need to make phone calls when I'm not with my binder. So I keep contacts and information in my phone and also on the binder. I like to be very organized with the information, just as Nicole said, when everything comes in, but the most important is that explanation of benefits. I do nothing before I get that. I always staple and paperclip that with the primary, the secondary, check all the information. I'm big on highlighting, highlight the date of service. These are the things they will always ask you about. And yes, definitely check on that procedure, the CPT. I can't tell you how many times it was billed wrong. Also, with a primary and a secondary, even though our insurance hasn't changed for years, because people are human, their billing departments change people and they will switch often. It just is mind-boggling how often they'll switch and they'll bill the secondary first and then the primary. Well, then you have zero coverage because the secondary says we can't. There's also not a clean handoff between the two. So keeping those together, keeping that information and going forward with that is number one for me. Once we do determine that we do have a bill that we have to pay, I am big on, first of all, depending on how big it is, I'll be honest, we pick our battles. So if it's a large bill, I write a compelling letter. And I have even done this for trials that we're finishing up where we were trying to get compassionate care, actually, on different chemotherapies, and we had a situation where they were closing it out because they got their FDA approval and the timing was going to be awful. We needed that drug immediately, not later. The oncologist needed it. He requested it. We couldn't get it. And my approach was pretty deep. I decided to find out the drug company name, which would also apply if you want to do this to your insurance companies. Just saying, it's kind of like this whole internal-external process, but I kicked it up a notch. So I wrote a letter to every board member of the drug company. I sent a personal photo. It was just a copy of us. I wanted them to see the face of what they were denying, who they were denying, and wrote a very compelling explanation of why we needed that. It was very successful, I will say. I spent the money and overnighted that to each board member so they each opened it up at the same time. And, just wanted to let them know that I wasn't going to go quietly into that good night. So I think persistence is a key. Just as Nicole said, it's very important. Your first denial is not your last. I'm in sales. You never quit. You just never quit. It takes 7 times to tell me no before I'll accept it. Keep fighting. Keep going back. The first person you talk to often doesn't have the right information. I keep the information when I'm talking to the billing people. When I find someone who is really good in the department and understands what's going on and goes through it and says, oh, I see an error, or let me help you with this, write their name down. See if you can get a direct line. It's kind of important when you find someone that's really good to do that. In the end, when we know we have a bill that's going to have to be paid and it's just too sizable, I tend to put in what I call a good faith payment. I write the letter as I send that in. This is what we can afford. We're doing everything we can, and we do make a good faith payment every month. So there is some, and I don't know, Nicole could speak to that or someone else maybe, if that's enough to keep it off the credit. We've been very successful with that as long as I'm continuously trying to do something. Let's see. I also agree if it's too much for you. For me, it was something to focus on that I could be helpful with my husband, and I felt like I had a bit of something to offer with my organization and doing that while he was fighting the cancer. I could do something with this, so it was helpful for me to do it. But if it's not, also look at your family, who's good with this, who might be willing to help. We get a lot of people during the cancer journey that say, how can I help? And this is a very concrete way. If someone would come into your house, help organize all of this information, do the highlights, the staples, put together the binder, just help you get organized, right? Maybe it's make some phone calls, maybe not. And in addition, I guess, to these programs where you can actually hire someone to do it. But often we have a neighbor or a friend or a family member who would be willing to do something with that. Trying to think, what else do I have? That's really, I think, the highlights of what we have done and how we've been able to be successful. And I'll turn it back over and let the conversation continue with questions.
Thank you, Tina. I have a couple quick questions before we open it up. One, Tina, just hearing everything you went through with your husband and went through trying to keep everything organized with the finances, I was tired for you. What helped you and your husband get through on some of the tough days coping-wise?
I think really it's taking it in small chunks. So it definitely can be overwhelming with the paperwork. All billing paperwork, medical paperwork goes into one pile, and there are days that you are too busy in the middle of cancer care to even look at it, right? And for me, I'm a morning person, so my energy and efforts have to be done early. By the evening, there's no way I could deal with that or even look at it. And you know, I think small steps. It doesn't have to all get done in a day. The piles, I am big on lay it all out on your big dining room table, on the floor, wherever works for you. This bill goes with this, and by dates, and keep it kind of organized as you go. And then, you know, pick up and just do one thing at a time. Don't feel like you have to do it all, but it is a big victory when you get through one. And when I'm completely done with the entire thing, I staple it all together, and on the top I write paid bill, done. It's, you know, however that's resolved. I still keep it. I'll be honest. It goes into another big binder that just kind of gets filed away, not into the binder, but in just to a filing system of this is part of the medical. So I think be kind to yourself, try to do small steps, and, you know, do it when your energy is high.
Thank you so much. And then to you, Nicole, as far as what Tina had said regarding good faith payment, is that usually something that will keep that off your record?
So I haven't heard of it in terms of good faith payments, but typically, and it really depends on your provider, you can set up what she's discussing, which is typically a payment plan. So depending upon the provider, sometimes it's $10 a month, sometimes it's $50, sometimes it's more. As long as you're paying towards the bill and indicating that you're going to keep paying, it will remain out of collections. One thing that I did neglect to mention when I was talking about the appeals process is if your health insurance company denied a claim and you are in the appeals process, typically you wouldn't pay the bill. So what you want to do is you want to call the provider and let them know that you're appealing the health insurance denial, and you want to ask that they make a note of that in your chart so that it doesn't go to collections, and if they need any additional information or any other process to make sure that it's essentially on hold until that determination is made.
Great. And just a couple more for you.
I'm sorry.
I'm sorry.
It's Tina. I just wanted to add one thing, and I thought about that I do often. When you get that the bills, you have bills from the doctors, bills from the hospital. Yes, it's an insurance, but you can go directly to the hospital and ask for forgiveness. You can also ask them and write them the compelling letter. You can do that to the doctor. When I was very young and had some medical bills that I physically could not pay, I wrote letters, and actually for my doctor delivered 2 cords of wood. He took it as that was his payment in full. I mean, there are so many creative ways to see what you could do to not have to pay, but it's not just insurance. It's all the individuals.
Mm-hmm. Yep. And sometimes it depends on the provider or the facility, but sometimes they will waive a significant amount of the fee if you pay a lump sum. It really does depend, but it's always a helpful tool to start with as well.
Great. Thank you, ladies. And one other one, I know we have heard about this quite a bit ourselves. One person writes, I have multiple myeloma and just had an autologous stem cell transplant. We have been told that our income is too high for a grant, and we're looking at $10,000 to $12,000 a year for one medication. We're retired, and this is a huge unexpected expense on top of dealing with the diagnosis. What can we do? Any thoughts?
I have a few thoughts, but they're pretty long-winded. I would suggest filling out an intake form for our legal and financial navigation program, and we'll walk you through a few different options. But we have a resource called cancerfinances.org, and on that is a financial assistance resources part. We don't provide financial assistance, but we've gathered the information of various organizations that do. So while your income may be too high for one organization, there might be others that it's not. And then in terms of the medication, I'd need to know a bit more about what your health insurance is. And for example, if you're on Medicare, if you're on an Advantage plan, or if you separately have a Part D, and different questions like that. That's why I suggest contacting our legal and financial navigation program, and we can discuss next steps as well as potentially reevaluating your plan for next year.
Wonderful. Thank you, Nicole. Okay, Jake, can you tell our callers how they can ask a question, please?
Of course. Ladies and gentlemen, if you would like to ask a question, please signal by pressing *1 on your telephone keypad. Keep in mind, if you are using your speakerphone, make sure your mute function is released so that signal can reach your equipment. Once again, *1 for questions today. And there will be a voice prompt on your phone line that indicates that you have an open line. Just state your name before posing your question. And we have a couple in the queue. We will hear first from...
Yeah, hi. I have Medicare and also have a secondary insurance. And what happens a lot of times is that I'm getting billed by the hospital before they bill my secondary insurance. I have to keep calling them. So I'm not sure if they're actually being paid or not.
Any recommendations for that, Nicole?
So if they haven't billed your secondary insurance, you would want to ask them to, and then see if you may need to follow up with your secondary insurance to confirm that they received the bill. And then again, you should be receiving an explanation of benefits from that secondary insurance that can help you understand.
Which I do. They keep sending me things that go to the hospital. They're asking for more information. So I really have no idea what's going on, whether they're getting paid or whether they're not getting paid. I haven't heard from either end.
So if you're not sure if they're getting paid or what you owe, you can also go back to the hospital and try to clarify. Sometimes they have itemized lists, and you can ask what has been paid and what hasn't and what they think you owe. But you'd also, if the health insurance company is asking for more information about a certain procedure, you'd also want to make sure you're working with your provider to get that information to them.
Okay, yeah, which I've done. So I'm just, all right. That's pretty much what I've been doing, just waiting for answers to see if what's being paid and what's not being paid. Right,
and sometimes it does require some additional following up on your part just to make sure they didn't forget to send you the bill or it's not lost in the mail somewhere. So sometimes you do want to just make sure you're calling them every so often as well.
Okay, all right, thank you.
Okay, yep.
We'll now move to our next caller. We'll hear from...
Hi, my name's Louise, and I just wanted to add one thing that might be helpful. Another thing that helps me is that we qualify income-wise for financial assistance through our hospital here in Bennington. So right now we're at 65%. So, that helps. It discounts our medical bills by 65%. I tried to do that for hospitals in Massachusetts, but we're in Vermont, so they don't. It's only for, when you're in state. But they have been helpful, and I've been on payment plans with the hospitals in Massachusetts. So I just wanted to add that because that's probably would be helpful for some people.
Thank you so much. We appreciate that resource.
Can I just have a quick comment on that as well? This is Tina. I also keep a copy of, after we file our taxes, keep the main form on my phone. I often have to send that for qualification and for different programs. So have a copy of your taxes as soon as they're done every year, kind of ready in your binder or wherever you need to. So you can just take a picture of them and then send them on off.
Thanks, Tina. That is a good one. Okay.
We'll now move to the next caller. And we have two more in the queue we'll hear from.
Hi. Yes, I have a question about switching from an employer plan to an individual insurance plan. And the question basically is this: is there a way? It's my understanding legally, insurance companies can't deny you coverage for pre-existing conditions. But our doctor told us my husband's getting ready to need treatment, and he'll likely need it once we switch over to this individual plan. And he said, make certain that they cover this form of cancer and that there isn't a waiting period that you have to be on board with them before they cover it. And he admittedly said, I am not the insurance person, so I'm not staying abreast of all of this, but it just really concerned me because I've done a lot of research in choosing the insurance company and hoping that we can qualify to get it on the exchange so we can get a reduced rate. But I want to make sure we've got the best coverage possible to take care of his needs. Any thoughts or guidance on that?
So this is Nicole. So I was actually going to ask a few questions that you answered. So the health insurance marketplaces were created by the Affordable Care Act, and the Affordable Care Act is the protection for individual plans that they can't charge you more or deny you coverage because of a previous or current health condition. Now, where people can run into issues is sometimes they end up with plans because they bought them through a broker that don't necessarily fall under those rules, and they may have pre-existing exclusions or conditions. That you mentioned that you were looking through the exchange. So if you go, and for anyone else that's wondering, if you go to healthcare.gov, some of the exchanges are run by that website, and you'll know once you select your state. Others are run by your specific state. If you're concerned about getting the right website, you go to healthcare.gov and select your state, and if it's an outside state that provides the marketplace, they'll send you directly to that state's website. And so if you are purchasing a plan on the marketplace, they have those protections. Does that answer your question?
Okay. Well, it does, except that I won't get into all the details because I don't want to take too much time, but the problem is that we're retiring, but we're not qualified for Medicare yet. And so we're going to be living on cash until we can tap into our 401ks. And so if you don't make a certain amount of money, you don't qualify for the exchange. And so there's the possibility that we're looking at the Anthem Gold plan, and we can buy that same plan as an individual through the broker we've been connected with through the health exchange, but we would not be purchasing it on the health exchange, but it's the same plan. It's just we have to pay the full premium with no subsidization by the exchange. So does that, if it's the same insurance company and the same plan, does that risk of pre-existing conditions apply?
So that's Kind of hard for me to answer, and I think it would be helpful if you have specific concerns to contact our legal and financial navigation program, and we can discuss more in depth with your particular facts.
Okay. Thank you.
Thank you. Do we have any more callers, Jake?
We have one more in the queue we will hear from.
Hi, this is Troy. I'm in California here. I've been listening to this. I had a bone marrow transplant. I made it through 2 months out and back home, and did get a stack of medical bills, but I was very fortunate enough to set myself up with a lot of foundations and really had the great help. I didn't have a bill at all, so it was completely paid for either through Anthem Blue Cross. What wasn't was completely forgiven through the financial hardship that they have there. So I walked out not paying anything there at all. And I did have to switch Anthem Blue Cross, just like that last lady on the phone was saying, over to a COBRA plan because I was employed. I'm no longer able to work. So in essence, I contacted them, and my foundation is paying the bills 100% on my co-pays to the Anthem Blue Cross. So I got very fortunate there too. So I have no bills there. So these are things that people ought to be looking into. I mean, the foundations are there. This is through the Lymphoma Society, Cancer Society. They paid 100% on all of my stuff. Gave me a really large amount of a grant. So I'm able to pay for everything. And I'm sitting pretty good right now. I just have 2 other hospitals, though, that I'm also having to deal with. And, again, the foundation is going to take a look at what they can on that. Obviously, you have to do the itemized copies because if you're not having a surgery or procedure or something, they don't pay it. I found that out the hard way, and I'm trying to recoup a lot of my copay since I paid a lot of that up front. So just got to show the proof of that. But otherwise, I've been very fortunate on that. I think other people should take advantage of this. I was, very lucky to get it all taken care of. I feel, I also applied for Social Security benefits. I'm only 54 and I'm not old enough yet, but, they went ahead and granted it to me due to my condition. And I did that way back in December, knowing that this was going to come up. I just planned ahead. So I took 7 months to get approved, and you got to wait, but you'll get it. And then Medicare doesn't kick in until after 2 years. So that's just standard on that. I can't do anything there. So I'm carrying my insurance as far as I can with the grants that are available. So that's what I recommend. Again, everything's being paid for, my mileage, my gas, my food, everything I'm doing, because I have to drive over 50 miles one way to get to the hospital. So I'm able to get all that money back too. So I guess right now I'm sitting pretty good. And I don't know. Anybody else have any questions on that?
Thank you.
This is Tina. Sorry, I just wanted to also say that leukemia lymphoma is also for multiple myeloma. So the first person who asked the question just in writing, they would also be able to look into those grants and foundations. Leukemia lymphoma.
Highly recommend it.
Multiple myeloma. I do too.
I walked away with no bill at the hospital. So, I mean, it's everything is doable. Everything is there for you to take advantage of and do it. It's there for the cancer. The people donate and take care of us that are going through a real rough time. Insurance is available through the foundations. They'll take care of it. You have to qualify, I guess, I'm thinking. I don't know, but I'm not working. I have no income, and I'm relying on my Social Security, which is going to come in the next 2 weeks. I'll be starting on that. So I'm feeling pretty good there. You do got to wait 7 months, which was a little bit of a hurdle. And they just want to make sure that you really are sick and not taking advantage of the system. So I can't complain at all. I am working out some little kinks and with some of the hospitals. Some of them are demanding payment, trying to threaten me a little bit, saying they're going to put me in collections. I told them I just got out of the hospital after a BMT. And, I just said, you got to give me a chance. I've got 3 hospitals I'm working with here. So I took care of the one. I'm down to the other 2 right now, and what's not paid by the insurance, I send it over to the foundation. And what they don't pay, I then go ahead and file hardship with the hospital, and that's how you can get out of it. Good majority of the bills that are due. So that's what I'm doing, and it's been working.
Well, thank you. Jake, is there anyone else on the line?
We did get a few more in the queue. We'll move to the next caller we'll hear from.
Hi, this is Jeff. Calling from Tampa. I was diagnosed with MDS about 2 years ago. I was originally I guess you'd say fast-tracked for BMT back in September of 20. We backed off on that because my numbers were good. Gone through ATGAM infusion. And seems like my time is coming to fruition in terms of back to BMT. I was just wondering, are there any, I must first of all thank you for holding this teleconference, and as well my kudos to nbmtLINK for their helpful resources page. I've never seen quite so many links to the foundations and other sources of financial support and, just support in general. But, and I would definitely recommend the Bone Marrow Foundation as well as the Leukemia Lymphoma Society and MDS, obviously, Foundation for myself specifically. Of all these resources, are there any that you would say specifically would target? I'm concerned regarding living expenses for my homestead while I am indisposed in Moffat.
Any thoughts, Nicole?
So I don't know anything off the top of my head, but if you go to cancerfinances.org, we have a financial assistance resources module, and there is a living expenses part of that as well. They're all different parts, though, so we really suggest people take a look around at all the different parts and all the different organizations, because you may be not thinking of one area that you may actually qualify for assistance for. You could get that assistance, say it's on utilities, and then move money around to pay different bills.
Understood. I appreciate that. Yes, and I must say I was overwhelmed when I saw how long your helpful resources page was. It's quite impressive.
Thank you.
And thank you very much.
Well, thank you. We appreciate the kudos.
We'll now move to our next caller we'll hear from.
Yes, I was just wondering if if all of these links and references and resources you've mentioned today, are all of those included in the recent email we got?
I'm sorry. Go ahead.
I was going to say I have not yet sent it to Jennifer, so for my part, no, it is not included yet.
Well, once I get it, I am going to share with all, and I'll put a couple notes together too. Okay?
Great. Thank you.
Thank you so much.
And I should have that to Jennifer hopefully by the end of the day.
Great. Thanks.
Thank you.
And we have one remaining question. We'll hear from.
Hello, my name is Alice, and I have acute lymphoblastic leukemia. I'm having a bit of difficulty getting a hold of itemized billing because they want to provide it to Medicare and then my supplemental insurance, and that's fine. But I also have an AFLAC policy that pays me directly to use for things like living expenses and stuff. And so is there a legal requirement that hospitals, et cetera, give you an itemized bill? It seems to me that when I get things from Medicare, there's no way I can really compare what really happened to what they're saying they paid without it. And in this case, I need it in order to receive benefits from AFLAC from my cancer policy.
So I just want to clarify, you've requested it and your hospital is refusing to give you an itemized, or your provider is refusing to give you an itemized, or is it just that they haven't provided one yet?
Well, my first out of 3 initial hospitalizations, they were sort of just separated by a short period of time, and AFLAC suggested that I get the itemized bill before I left the hospital. And when I requested it for the following day, the day I was first going to be discharged, they said I could request it 8 to 10 days after I was discharged. By then, I was back in the hospital again. Anyway, what it all boiled down to is that after I was finally a bit better and was still receiving treatment but was no longer hospitalized, I tried and was told that they didn't understand the AFLAC policy. So I think they thought maybe I was trying to cheat them out of getting paid. But they're getting paid by Medicare Part A, Part B, my supplemental Plan F. And so this was money that would assist me with living expenses. But the only way the AFLAC policy is written where you had to show, the itemized bill so that they can look on their chart, which is in my policy, as to various benefits that they'll pay based on what actually, how you were treated. And so I figured that maybe that was a legal requirement that you have access to your itemized bill, but I have not been able to find anything online that says that there is, that you legally have the right to see your itemized bill. This time, which was my 4th time in a particular hospital, this time I was given a 3-page, it's not 3 pages, it's a 3-fold brochure. And when I read it about their policy regarding bills, they only give to the patient what is due after their insurance pays, or after, if they have Medicare, what Medicare and the supplemental insurance, if they have that, pays. So what they want to provide is simply amount due, not what your charges were. And so I kept insisting, and finally, months after I was in the hospital, I finally got itemization and sent it to AFLAC. But my cancer treatment is ongoing, so I need to get more itemized bills. And I'm just wondering if there's some law that I can refer to when I have the conversation. Is there a law that says that I'm entitled to it? If so, that if I could state what that law is, maybe it would help me be able to access what I need more quickly.
Okay, I'm happy to do more research. Do you mind telling me what state you're in? I'm very grateful that I'm receiving treatment, and I don't want to foul up anything. I don't know who's listening to this call. So privately, I would be willing to give you information on that. So how about you go to triagecancer.org/gethelp and fill out an intake form, and then we'll set up a time to talk more about what's going on and kind of some next steps and any rules that may apply.
Okay, and I tried to write down the site that you just mentioned earlier in my notes. I'm on page 2 of my notes, and I'm going back to page 1. And okay, so triagecancer.org, I did have that part right. Is it just the first T to capitalized and everything else lowercase, or do I need to capitalize the C on cancer?
Nope, you're fine without it being capitalized.
Okay, and after ORG, is that where I put the slash?
Yep.
Is it a forward or a backwards slash?
Forward.
A forward slash, and then what?
It is get help.
And, okay, so lowercase g on get and help lowercase?
Yep.
Okay. And thank you very much.
You're welcome.
And thanks for this whole call thing that you're doing. Everybody involved with it, the sponsors and everybody else. Thank you.
Oh, our pleasure. We are so glad that we were able to help today. And thank you so much to our speakers, our sponsors, all of you joining us today. We hope you got another tip you can use to try to help yourself navigate finances with this cancer journey. And if there is any way we can be further supportive or further support you, please feel free to reach out to us at nbmtLINK. Thank you so much. Everyone have a great day.